London's news.
With Penny Smith and Paul Ross.
Weekdays from 6.
BBC Radio London.
The time is 23 minutes to 8. It's Thursday, it's the 10th of December. Researchers are warning the NHS is going to struggle to cope this winter without more beds in care homes and more support in the community to ease pressure on hospitals. The Nuffield Trust says last winter a very small proportion of patients, around 3.5%, took up more than a third of hospital beds. So that's 3.5% taking up a third of hospital beds. The Chief Executive, Nigel Edwards, says more needs to be done to provide other forms of care.
Difficulty I think many people in the NHS have is they're so busy fighting fires that the time that you need to take to plan what is often quite complex care for these people is taken up with dealing with the immediate urgency of sorting out the 4-hour wait target in the A&E department.
Now, the NHS says the report shows the importance of joined-up care. Rob Webster is Chief Executive of the NHS Confederation, which represents hospitals, trusts and other NHS service providers, and he joins us now live in the studio. Good morning, Rob.
Good morning.
Do these findings tally with you? What's the reality on the wards, would you say?
So these findings are really timely, and they tell us something that we already know, I think, which is that older people and the way that we support them in communities are part of the solution to making sure we have a sustainable health and care system.
So this is people like, for example, district nurses going to see people at home, but people have to be allowed to go home, and definitely there needs to be the care there to help them.
That's exactly right. And if you look at some of the work that's going on in London around this issue, you can see some fantastic developments. In North East London, they've worked with the Ambulance Trust and community services so that if a frail older person falls at home, first people on the scene in the ambulance are a community nurse and a paramedic. They're trained to do an assessment on the fall and whether there's been a fracture or any sense of, a hip going. 71% of the time, they keep people at home. And that means that they're not being transported to hospital, not being disrupted and being kept safe and well. And that's the best place for them.
And not blocking beds.
I think
as they call it.
I've talked about this before. I mean, we should be very careful about labelling people as bed blockers when it's the system that has left them in the wrong place.
So who are these 3.5% of the patients who are taking up a third of the hospital beds, and what are their conditions?
We know that there are 11.5 million older people over 65 in the country now, and 3.5 million of them live alone, and they're significantly more likely to have 3 or more long-term conditions. So what you might have is asthma, COPD, which is respiratory illness, cardiovascular disease, a bit of heart failure, maybe dementia, and you need some pretty good support at home. And often people get into hospital and they might pick up an infection, which increases their length of stay. We were doing some work in Sheffield recently where we saw that somebody was medically fit to go home on day 2 and didn't go home for 71 days because they picked up an infection and then they got a bit stuck.
The big question, of course, is who is losing out because of this?
Who's losing out is the patients. Fundamentally, we've got to think about how do we keep people well at home. That's the best thing for them, and that's why we exist as a service. To do that, we need a combined response from the NHS and from social care. The big issue today is that we believe the Chancellor's settlement for the NHS and care system doesn't bring enough into social care services. So that's the people who come round and meet your care needs, get you out of bed, make sure that you've had a cup of tea.
So it's not about more money, it's about where the money goes.
It might be about more money for social care. We believe next year social care providers have to meet the cost of the living wage. They're already under significant pressure. It might not be about more money for the NHS. What we need to do is make sure that NHS care is well coordinated and people move through the system smoothly. What we find, though, is if you don't have good social care support, people can't. And then they do get stuck because their care needs are not being met.
In fact, we had a point along those lines made about a year ago when the first wave of council cuts was coming in, and somebody phoned us, I think from Lambeth, south of the river, of course, and said, look, our kind of daycare drop-in centres being shut. It's not a medically approved facility, but it's a place for people to go and talk. But, of course, the knock-on from that will be you might spot if somebody is looking a bit uncertain, a bit kind of dodgy, looking a bit under the weather, and also people can kind of stay healthier if their mental health is often better. So I suppose that's the kind of impact as well you're up against.
We do find that you've hit the nail on the head, Paul. So we need to be working with people in their daily lives. And in the southwest in Cornwall, what they've done is work with Age UK and their staff and volunteers to say how are we coordinating the care that happens to people anyway, because they've got charities who are working with them, they have council services, they've got the NHS. And if you join them up more, and if you have somebody you can always ring if you're worried to help you make sure you've got the right sort of care, then the outcomes are much better. And what they've found is they've picked 1,000 people in 9 different places in the southwest who might be frail and older, the kind of people we're talking about in this report. And they've seen a 50% reduction in the amount of time they get admitted to hospital, because you can see when they're starting to become unwell. You can put things in place to support them. And this is where the debate needs to be. I think we often default to A&E and hospitals, but that's the symptom. It's not the cause. And what doctors need to do is treat the cause, not the symptom, and we need to do the same.
Is there anything that families can do now? Obviously, it's because it is winter, even though it might not necessarily feel like it at the moment, but it is winter, therefore it is more likely that older, frailer people are going to end up in hospital. Is there anything that families can do to try to help?
Well, we all need to look at who's involved in somebody's life, including the family. Not everybody has family, and sometimes they have to rely on informal carers or friends and relatives. But we should all look out for our neighbours and frail older people. We know that from work we've done in other parts of the country where people are discharged from hospital to be assessed at home to see if they can cope, what the staff find is if some members of the family come round while they're doing the assessment, which takes a couple of hours, if some friends have popped round, they think, well, actually, this is probably going to be okay. If they go back, the house is cold, empty, nobody's been there for the whole time someone's been in hospital, they know it probably won't. So what we all need to do is think about how we use the service. You know, if we've got a cough or a sniffle, we might just go to the pharmacy and get some advice. If you start to get a bit worried, ring 111. It will give you some good advice. If you really need care, go and see your GP or go to A&E, because the service will be there. But just be sensible and think.
Thank you for joining us. Rob Webster live in the studio, Chief Executive of the NHS Confederation, which represents hospitals, trusts and other NHS service providers, talking to BBC Radio London, where it's now 7:44. Thank you very much indeed, Rob.
Thank you.
You've been a very